everybody. I am Sanya, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely, and it may due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown as well. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years, and incidence is higher in older age group as well. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it is a boom or blessing if we get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach of an early relief. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. Spandana P Hegde. She is an MBBS MD dermatology. She is a dermatologist from Mangalore. She has years of experience in this field, and her skills and compassion have made a tremendous difference in patient life. A very warm welcome to you, Doctor, and it's a pleasure to have you with us today. And we are going to discuss a very important topic, that is how we can manage urticaria.
Thank you very much, Ms. Anya, for your warm introduction.
And Doctor, as we are going to discuss urticaria, my very first question to you is that what is urticaria? How we can simply define urticaria?
So, urticaria is something like you develop itching on the body. So, it is associated with itching and rashes. So, these rashes develop as red colored rashes. So, it may appear spontaneously. It may start at one place and sometimes may be localized to that place, or at times it may involve the entire body. So they are red rashes and it's associated with some amount of swelling also. So if you touch the urticarial lesions, it will be kind of warm and it is swollen. There is a lot of itching associated with urticaria. That is one important symptom. And one important part about urticaria is urticaria appears and usually it stays for around maximum for a period of about 24 hours and it vanishes on its own and then it vanishes to develop fresh lesions. So fresh lesions of urticaria keeps coming. So the dictum is if it is urticaria, the lesion, one particular lesion or that rash which has appeared, usually goes away within 24 hours. If it doesn't go away within 24 hours, we should think of some other causes other than urticaria. So simply it is called as hives. In layman term, it's commonly called as hives. So spontaneous onset of red rashes or bumps on the body, along with some amount of swelling and itching.
Okay, doctor. And as you said that it may go after 24 hours. That means if somebody is having some kind of swelling or itching, and it may disappear after 24 hours, and it can again come after
Yes,
that.
yes, yes.
Okay, so that's
So
how we
once
can
the
define it.
urticaria, yeah, once the
Yes.
urticaria disappears, the skin turns normal. So there will be no telltale sign to tell that there was an urticaria. So what happens is most of the times patients will bring pictures. They will tell, see doctor, you may not believe, but I had this last night. See how my skin was last night and look at it now. It's completely normal. There is no sign to tell that I had a lesion on my body. So that's how it vanishes completely without leaving any signs, because most of the other diseases will leave some signs like a pigmentation, there may be scarring, but urticaria resolves spontaneously without leaving any back the post-inflammatory changes.
Okay, doctor. So how one can see the urticaria and say that this is particularly are the symptoms of urticaria?
So the first symptom will be itching. So initially the patient develops itching. followed by development of the red swellings, whatever I've told you as hives, that is the swellings. So it can develop in any part of the body. Literally any part of the skin can be involved with urticaria, and it can be progressive. So as I told, it may be limited to one particular part of the body, or it can spread rapidly. It all depends on the cause of urticaria. So symptom will be itching. So intense itching will be there. Patients will initially develop intense itching, followed by development of this red swellings in the body, red rashes or swellings in the body.
Okay, so red rashes and swelling are the major symptoms of urticaria. If someone is having a kind of rash and it's also swelling and itching, that are the symptoms of
Yes.
urticaria. Now, doctor, we have discussed about what is basically urticaria, what are the symptoms. Coming to the cause of urticaria, what are the different causes of urticaria?
So broadly, there are a lot of causes for urticaria. So broadly, if we want to say urticaria, we can group it into two categories. So the first category, what we call is an acute urticaria. So all the urticarias which last for up to a period of 6 weeks are termed as acute urticaria. And any urticaria which lasts for more than 6 weeks, it could be 6 months, 6 years, or any, it can go on for any period of time. So those urticarias are classified as chronic urticarias. Now, it is important to classify urticarias into acute and chronic because most often the causes of acute urticaria and chronic urticaria are totally different. Say, for example, acute urticaria, the most common causes are infections. Now, it could be an underlying viral infection, underlying urinary tract infection. There may be a vulval vaginal infection or a dental infection. All these infections could trigger urticaria. The second important trigger for an acute urticaria is food. So, food items. So, we see a lot of people who complain of urticaria following ingestion of certain kinds of foods. So, this is about food. Then, and another important cause is medicine. So, medication. There are a lot of medications which are known to produce urticaria. Sometimes some other infections or inhalation of some dust, mite, pollen, all these also may cause urticaria. There might be some infestations, like we have these worm infestations. So worm infestations also can produce urticaria. So all these are important causes of acute urticaria, and these usually last for a period of less than 6 weeks or so. When the urticaria continues for a prolonged period of time, as I said, more than 6 weeks, which could be 6 months or more than 1 year also, then it should be a continuous activity. Now, see, there are some people who get urticaria once in 1 year or so, so they don't come under this category, they are episodic. So for the chronic urticarias, the causes are different. Chronic urticaria could be because of some thyroid dysfunction. It could be because of allergies within the body. It could be because of some other endocrine disorders, like sometimes it can be associated with diabetes. So, or then we have one more category of urticarias called as physical urticarias. Now, there are some people who sit with pressure at a particular point of the body for some time, they develop urticaria over that area of the body. Some people develop urticaria on exposure to cold, some people on exposure to sunlight. So, these are all the chronic urticarias and the physical urticarias. So, causes can vary. Even there is something called as aquagenic urticaria also, where contact with water can cause urticaria. So these are all broadly the causes of urticaria. In addition to this, there are some diseases called as autoimmune disorders. So these disorders also can cause urticaria. And finally, when we have a big chunk of category where we do all the investigations, we try to find out the cause, and then still we are not able to arrive at a particular reason for urticaria. So this category we brand it as chronic spontaneous urticaria. So urticaria appears spontaneously, but we exactly don't know what is the cause of the urticaria. So this category is chronic spontaneous urticaria. So these are all the various causes for urticaria.
Okay, doctor. So that means these are the various causes of, as you told us, the different types of urticaria, that is acute, chronic, and different types of urticaria which exist. Doctor, here comes the question that sometimes people also self-medicate themselves, and they don't go to a dermatologist saying that this thing happens to me a lot in cold or in summer or at a particular rainy season, we can say. So what are your suggestion to the people who self-medicate their urticaria in spite of knowing that this can be something serious in their body?
Yes. Self medication at times can be harmful. So, if the patient or the person with urticaria is self medicating with antihistamines, there are some group of medications called as antihistamines, it would still be fine. It is relatively safe, but it is always better to consult the dermatologist, because the dermatologist would give the actual dose. How, like for example, a patient has urticaria, so we assess the patient depending on how much symptomatic the patient is, what is the frequency of urticaria, what is the cause of urticaria. So we try to analyze the cause, because if it is something which is a treatable cause, the underlying cause has to be treated. Say, for example, is an underlying infection. So it is important that the underlying infection gets treated. Otherwise, the urticaria is going to continue. So that's why identifying the cause of urticaria and treating the underlying cause is very important. In such cases, the self medication is not going to work. Rest of the times, sometimes with antihistamine, it's still okay. It may not cause a lot of adverse effects, but lot of people do self medications using steroids. So steroids are easily, people go and buy over the counter. So steroid, if there is a steroid abuse in cases of urticaria, then it can lead to a lot of adverse effects, including steroid induced diabetes. They can develop renal problems, they can develop complications in the eye, and multiple other things. So that's why self medication most of the times might be harmful to the patient rather than doing good for the urticaria, because urticaria is something which is a manageable condition, treatable condition, not a very difficult condition to manage, but the adverse effects may take an upper hand and do more damage to the patient.
Okay, doctor. So that means the people should not self-medicate themselves if they have any symptoms or signs of urticaria. They should go to a dermatologist, and as you said,
Yes,
that it may be harmful.
yes, definitely.
Yes. And doctor, we also have some live viewer question as well who are watching this live. So there's a question that can urticaria be a sign of a allergic reaction?
Yes, urticaria happens because of an allergic reaction. See, urticaria is a form of allergy in the body. So it is definitely a sign of allergic reaction. It is one of the signs of allergic reaction. This allergy could be to environmental agents, as I've already stated. It could be allergy to some dust mite, pollen. So people who have a background allergy are more prone to develop urticaria. So it is a sign of an allergic reaction of the body.
Okay, so it is a sign of allergic reaction to the body. Doctor, here comes a question that sometimes people or have urticaria in the hands or in the neck, and they itch themselves in public. So people are away from them that it should not come to us. So the question is that is urticaria contagious? Can it spread from one people to another?
No, urticaria is not a contagious disorder. It cannot spread from one person to another.
Okay, so that means if somebody is having urticaria, you need not to stay away
Yes,
from
you
them.
have a, yeah, yes.
Okay, okay, doctor. And doctor, what are the potential, we can say, complications of urticaria if somebody not treat them?
See, rather than directly talking about the complications, urticaria, once it is chronic, it can affect the quality of life of the patient. That's the most important complication. It's a social complication actually. So it may affect their work, it may affect their sleep, it may affect their daily activities, it may affect their scholastic performance. So mainly it is to do with the quality of life of the individual. So we have seen a lot of patients whose quality of life is impaired because of this constant chronic urticaria. Complications of urticaria do develop. So there is another entity called as angioedema. So urticaria, as I already described to you, it is characterized by red itchy swellings over the body. Now sometimes what can happen is, along with this urticaria, people can develop something called as angioedema. So in this angioedema, there will be swelling of the eyelids, there will be swelling of the lips. Along with that, the patient may develop swelling of the tongue, and then at such cases, it becomes a complication because they have to take emergency care at that time. Otherwise, they may have a breathing difficulty at those times. Or sometimes it may be even associated with anaphylaxis, where the blood pressure of the patient comes down, the patient might collapse. So these are the dreaded complications of urticaria: angioedema and anaphylaxis. Otherwise, other than that, urticaria may just hamper the well-being of the patient, the
Okay.
quality of
So
life.
these are the complications. If somebody is not treating their urticaria and they have urticaria and they're ignoring it, these are the complications which can occur. Okay, doctor, we also have live viewer question as the viewers are watching, and there is a question that how can urticaria be prevented?
Urticaria can be prevented. First, as I told you, if we try to find out what is the cause of urticaria, so at times we are able to find out. So we have to spend a lot of time with patients with urticaria in asking them a detailed history. Acute urticarias, it becomes little easier. We can ask, if say for example the urticaria is of a short period of time, 1 week, then we try to recall and ask the patient to recall and try to bring out some history, whether they have taken any new medicines, whether they have consumed any food from outside, because a lot of these food containing additives and preservatives, so all these food items can also trigger urticaria. So by finding out the cause, or if there is any, we do certain blood tests also at times, and if we find any focus of infection, if we treat that, then this urticaria can be treated. And the rest of the things, chronic urticarias, if you're not able to find a cause of it, the best thing to prevent urticaria is regular medications as advised by the doctor. So normally what the patients of urticaria, what I see in my practice is, what most of them do, they say I take one tablet per week or two tablets per week, and I develop urticaria 4 to 5 times a week. So it's the other way of doing it. We try to adjust the dose to such a frequency that they don't develop urticaria. So we see, for example, I try to see that I give 3 tablets per week and they don't develop urticaria, they don't develop symptoms. So we try to give them a symptom free disease interval. The tablets are spaced in such a way that they don't develop any symptoms. Then there are some general measures. For example, I talked about the physical urticarias. So some people, they develop urticaria on contact with a cold object. So in, or on long sitting for a long period of time, they may develop pressure urticarias. So in cases of these physical urticarias, we can tell them to avoid certain factors which will help to reduce the frequency of development of urticaria. So, but for the chronic spontaneous urticarias which develop on its own, there is nothing in particular to prevent it. In case we find out a cause, then definitely if we try to treat that cause, then the development of further urticarial episodes can be prevented.
Okay, so these are the various types of, or we can say the procedure from which the urticaria can be prevented. Doctor, we have talked about the cause, the symptoms, what is urticaria. Now comes how the urticaria can be treated. What are the treatment options which are available if somebody is having acute or chronic or any type of urticaria? What are the treatment options which are available?
The mainstay of treatment of urticaria is what we call as antihistamines. So antihistamines are broadly categorized into first and second generation. So what we usually give is the second generation antihistamine. So the only main reason for giving the second generation antihistamines, there are drugs like you would have heard of cetirizine. That is one common drug which belongs to this category, and a lot of people use it over the counter for urticaria. So there are many drugs like cetirizine, levocetirizine, loratadine, fexofenadine, elastic. So all these drugs are commonly used in the management of urticaria. So the advantage of these medicines are, as I told you, urticaria, some people can have a chronic urticaria which may go on for many months or years. So, and one important adverse effects of antihistamines is sedation. So that's why the second generation antihistamines, what I just mentioned now, have less sedation as compared to the first generation antihistamines. So the quality of life is also better. Otherwise, a patient of urticaria, every day the patient takes an antihistamine, next morning they're not able to get up and do their daily activities. So we always prefer a less sedating antihistamine in cases of urticaria. So we adjust the dose according to the symptoms. So we give the regular dose of antihistamines and we reassess the patient after a period of 2 weeks. We call them back and ask them how are they feeling, how much improvement is there in their symptoms, and depending on that we can updose the treatment also. The same medicines we can either increase the dose of the medicines depending on the symptoms. So this is the mainstay of treatment of urticaria. The mainstay of treatment is antihistamines. Then, if the patient fails to respond to these antihistamines after 4 weeks and 6 to 8 weeks of treatment, still the urticaria is not coming under control, then we think of second line therapies. We have something called as monoclonal antibodies against the IgE, which is important in mediating urticaria, called as omalizumab. So that can be given, or we have other add-on therapies to this antihistamines. Say, for example, there are drugs like cyclosporin, or even at times we give short courses of systemic steroids. It is under supervision. We give a very short course so that we come over that crisis of that acute urticaria and angioedema, and then we wean it off and then continue with the antihistamines. So, if you want me to say in one sentence, the treatment of urticaria is antihistamines. The dose has to be decided by the doctor as to how much the patient has to receive.
Okay, that means there are treatment options which are available. So if someone is having urticaria, they should go to a dermatologist and treat the urticaria, not left the urticaria just like an
Exactly.
allergy. Doctor, I am sure that you might have come across a lot of people who don't take the full medicines or the full treatment. Once they see that the urticaria is gone, and they don't eat their medicines or any type of drug which is advised by the doctor, what advice you would like to give to them? Because urticaria can come back. Is it the possibility, if it is not treated fully, it can come back?
Yes, definitely. So, in cases of acute urticaria, what happens is we treat the patients may require treatment for 2 weeks or 3 weeks, 1 month, and the urticaria completely disappears. So, as I told you, it all depends on the cause of urticaria. So, if it is something which is a treatable cause, the urticaria goes away. But then the problem happens with the chronic urticarias where we don't know what the cause is. So, this category of patients require the prolonged treatment. So these patients, every time we need to counsel them, we need to tell them why they need to take the medicine so that they can have a good quality of life basically. So it doesn't feel good when you're with someone, you're with your friends, and suddenly you start developing hives on your body and you start scratching and you become uncomfortable. So it is just to maintain their quality of life and even to see that they don't have episodes of angioedema also. So we take a lot of time in counseling the patients. We tell them the need for prolonged treatment. And also one more concern, most of the patients will have a concern when you give a long-term medicine about the side effects of the medicines. So the antihistamines, whatever give, are relatively safe. There are very few side effects, and that is one more thing which we have to tell, because people are normally, whenever you are taking a long-term medicine, people always are scared of the side effects. So these medicines are relatively very safe, cause minimal side effects. So it can be given on a long-term basis. So we do counsel the patient that treatment is important. They have to take antihistamines for a prolonged period of time.
Okay, okay, doctor. And doctor, are there any lab tests needed if somebody is keeping urticaria, and why?
Ah, lab tests may be needed in few cases. See, for diagnosis of urticaria, we don't need a lab test. So the patient has the hives, we see the hives, we know it is urticaria. So why do we need the lab test? We need few lab tests in case we want to find out the underlying cause of urticaria. Say, for example, we are suspecting an infection in the body. So if we are suspecting a urinary tract infection, we may need a urine analysis. or some other infections we are suspecting, we may do some counts of the patient and see whether the leukocyte count is high or not. What about the ESR, CRP, if there is any infection in the body. Sometimes, if it is any allergy related, we may do the allergy levels, eosinophil count, or there is something called as IG level, so we can do that. Or if it's chronic urticaria, we want to see if it is related to any underlying systemic dysfunction. Say, for example, if there is any underlying thyroid dysfunction or some other autoimmune cause for urticaria, we do some tests at that point of time. So we basically need investigations. It could be blood, urine investigations to find out the cause of urticaria rather than just to diagnose the urticaria, so that we can treat the urticaria appropriately along with the underlying cause.
Okay, doctor. And there are more livelier questions, and there is one question like, how does temperature affect urticaria?
Temperature does affect. See, for example, now there are some patients who develop urticaria on exposure to sunlight or heat. So there's one category of patients. So they go out in sunlight. It's called as solar urticaria. And then there are some patients who develop urticaria on exposure to a cold environment. That is known as cold urticaria. So these are the two temperature variations which can cause urticaria. Rest, on exposure to water, there are some people who develop urticaria. There are some people who develop urticaria on exposure to hot water, some just on exposure to water. So what we call as aquagenic urticaria. So these are all the variations in the temperature and the environment which can cause urticaria.
Okay, so that means different people with different types of symptoms can have urticaria. If somebody is allergic to heat, or someone is allergic to water, they can develop urticaria. Is it like that?
Yes, yes, yes. Urticaria, the manifestation would be same, but the underlying cause is different.
Okay, okay. And doctor, are there any dietary precautions one should take if someone have urticaria? So, do you suggest any dietary precaution that sometimes people, if they eat peanut, they develop some kind of itching in their body or something like that? So, what are the dietary precaution you would suggest to the people who have urticaria?
Yeah. So dietary items which are most important, most commonly known to cause urticaria are, one is seafood. So a lot of people are allergic to seafood, fish, prawns, shellfish, all of these. These are one important factors. The second one is ingestion of nuts, berries and nuts. So this is one more category, berries and nuts, which can trigger urticaria. Then these are the two important. Then some people develop urticaria on eating dairy products also. A lot of people on consumption of any form of dairy products develop urticaria. So these are the important food items. In addition to these, all the food additives or the preservatives which have been added. So there are a lot of people who complain when we go out in one particular restaurant and eat, or when we eat this Chinese food, we develop urticaria. So basically, it is the preservatives which are there in the added to that food also, which can trigger urticaria. Otherwise, the most common are seafood, even eggs. Eggs also can produce urticaria. Seafood, eggs, nuts, berries, and dairy products. These are the important triggers for urticaria.
Okay, so these are the triggers for urticaria. We were talking about the dietary precautions, and here's a question from a viewer that can food allergies cause urticaria?
Yeah, the same thing. I've answered that question already. Yes, these whatever food items I have mentioned, these food items can cause urticaria. But not all urticarias are caused by food items. So there's a misconception among patients or people. They say when they come and say, I eat this, that, I develop urticaria. So then we ask them further. These are all the patients who have chronic urticaria. So when we further ask them, what about the days when you have not eaten those food items? What about those days? Then they think for a file and say, "Oh, yeah, those days also have developed urticaria." That means in such cases, usually chronic urticarias, food is not the trigger. Food is a trigger in acute or episodic urticarias, which develops once in a while when you eat that particular food. Otherwise, chronic urticarias, usually the causes are slightly different. Food doesn't cause a chronic urticaria.
It depends on person to person.
Yes, yes.
And doctor, is there any age bar also to develop urticaria? If somebody is young or if somebody is older, will develop more urticaria, less urticaria? Is it like that?
Normally, in children, what we see are predominantly we do see a lot of urticarias in children, and most of the times it is an acute urticaria. I do have patients who are children with chronic urticaria, but the number is very few. So in children, it is always most often it is an infection. We see a lot of children even now during this season, a lot of viral infections going on, and urticaria is a manifestation of an underlying viral infection. A lot of children come with urticaria with an underlying fever and respiratory tract infection. So in children, predominantly it is an acute urticaria, whereas in the adults, we see most often a mixture of both. We see a mixture of acute as well as chronic urticaria. There is no particular age group. So all age groups, anybody from children till the elderly, geriatric age group, anybody can be affected by urticaria.
Okay. So there is no age bar. Anyone can be affected by urticaria.
Anyone can develop
Doctor,
urticaria.
okay, okay, doctor. And doctor, there is one more question: that can insect bite cause urticaria?
Yes, insect bites can cause urticaria. Contact with the insect, a bite, you could have more of a bee sting and all can manifest as an urticaria. Wasp, bee sting can produce urticaria, and even contact with like some products of the insects. It could be some hair of the insect. All of those also can trigger urticarias. All those will be an episodic urticaria. What I mean to say, it is one time. But then the rest of the causes, what I've already discussed now, are the ones which keep coming repetitively. Because
Okay, so you need to
urticaria,
find
one
the
time urticaria, yes, the cause. One time urticaria is usually a temporary thing that it will be there for some period of time, maybe few hours, and it disappears spontaneously. It doesn't bother the patient much. But what we are more concerned are the chronic urticarias because they go on for a long period of time.
because chronic urticaria for a long period they occur.
Yes.
Doctor, is it like that? Can urticaria be caused by stress, and are the stress urticaria looks different?
The symptoms are the same. Urticaria causing by actually it is a vicious cycle. The presence of urticaria may itself induce a stress in a lot of patients. And then again, so it's a vicious cycle. Urticaria, stress, stress, urticaria. Otherwise, manifestation wise, it's almost the same. That's what I told. It looks the same, but only thing is the causes are different. Clinically, it looks like red, itchy bumps on the body. Now there is something else. Now some people develop, you would have seen some people. You write on their skin, they develop urticaria along the lines of writing. So it's called as dermographism. So it is called as symptomatic dermographism. So there are one category of patients who develop only urticaria when you stroke their skin. So that is a separate category. The rest of the things, urticarias are the ones which are going to develop spontaneously. So clinically, when we see, without asking anything, if you see everything looks the same, only when you ask the history, we'll be able to find out what the underlying cause is. There's some one variety of urticaria which is called as a cholinergic urticaria, which develops on exposure to sweat. So that kind of urticaria is slightly different because the normal urticaria, the whatever the hives or medical terms we call it as wheals, they are large in size. Whereas in this cholinergic urticaria, they usually develop very small wheals. The hives won't be more than 3 millimeter in size. So they will develop only small wheals. Like how you get a mosquito bite and you develop a wheel. It is something like that. That is one variety of urticaria which is slightly different in manifestation.
Okay, okay, doctor. And doctor, someone also do this thing that if they have urticaria, the friend have urticaria, and they particularly is using some of medications or some of home remedies, and they suggest to others that I have used this home remedy, maybe applying oil or anything. What is your advice to them to use home remedies and as well as over the counter medicines suggested by their friends or family?
Home remedies, maybe as you said, some oil application or application of some calamine, some soothing agent may not cause more harm. And it may just give an instant relief to the patient. The itching, the symptoms may come down. Self medication, I've already told, it's better not to do, because what if the medication you're self medicating with is a steroid? So people are not aware what is there in that. So steroids do cause long term side effects, so it's always better to stay away from self medications.
Right. So always stay away from self-medication, and if someone of your friends suggests some of medications, don't apply it, because as doctor already told that it may do harm to you.
There is a misconception again, if it is a dermatology thing, okay, you just apply some cream, it will go away. So but the problem is there are a lot of creams also which can produce side effects. So you're using a cream which has steroids, so on the long run it does produces a lot of side effects which may not be limited to the skin itself. It may cause side effects inside the body also, in the internal organs also. That's why it's very important you see what you're applying, because if people just apply something, this is a cream, it's a kuch nahi hoga, so I'll apply this cream, nothing is going to happen. So that's very important. People should become aware that creams also can produce side effects. It's just not a cream, it gets absorbed into your body. It just doesn't stay superficially, it will get absorbed to the body, it will circulate in your body, it will spread to all other organs and can damage internal organs also, if it is of a high concentration or something which is not to be used in a long term.
Definitely, very well explained that applying just cream and thinking that it will not affect your body is more harmful. Doctor, any myths or misconceptions you would like to clear about urticaria?
Myths, one is the food item. So every patient who comes will talk about food. So what I want to say is food is not the only cause of urticaria, because most of the people think if it is urticaria it is happening because of food. So as I have given you a long list of causes, so any of these, any there are, other than what I have mentioned, there are so many, anything can produce urticaria. There are a lot of things which can cause urticaria. So what I do is I tell my patients, you just try, you go back, once you go back, you maintain a diary and you see, okay, how many times you have developed urticaria, and during that time did you have anything, what activity you were doing, or was it something unusual from your daily routine, something had happened, so which could, so because more than us, it is the job of the patient to find out the cause. So that every time the urticaria comes, they try to, okay, try to correlate, try to sit back, think, what did I do now, what did I do in the last 1 hour, did I take some medicine? So only when the patient puts in efforts, because me as a doctor, I'll spend maybe 15 to 30 minutes with the patient, so I may not be able to extract the entire thing. But when the patient goes back, I tell them to maintain a diary, and some of them try to, narrow it down to few, one or two particular causes. And if we try to find out the cause, the job becomes very easy. We have to avoid that particular thing. See, it could be a simple tablet of headache or something, and the patient may not be aware that the patient, whenever the patient is taking that tablet, they're going to develop. So unless we sensitize them, we tell them, you please make a note, you see when are you getting it. So that is a time when they try to, okay, find out and narrow down the cause of, okay, this could be the cause of urticaria. So the most common myth is food. Food is the only cause of urticaria. And the other thing is urticaria is not treatable. So I keep getting it. So it is okay. Uh, I will manage. I will get urticaria thrice a week. I can manage with urticaria. So the patient should be free of symptoms, is what our dictum is. So take antihistamines at a prescribed dose. Definitely you will be symptom free, the quality of life will be improved. And don't self medicate, because the self medications may do more harm than the prescribed medications. The people always, the other myth is medicines cause lot of side effects. It's not true. Self medications at times may cause, but when it is given under supervision, we are definitely going to monitor. We are going to see, in case we are suspecting any side effects. Also, we do investigations, try to figure out if something is going wrong, and it is relatively safe. So these are the important myths of urticaria.
Thank you. Thank you so much, doctor, for clearing all the myths and misconceptions about urticaria. There are a few more questions from our live viewers. That can urticaria cause breathing difficulties? Does heat cause urticaria? And can urticaria cause swelling?
Yes, urticaria, what I told you was the breathing difficulties. I've already answered this. When it is associated with angioedema, I told there is swelling of the eyelids, swelling of the lips, along with the tongue swelling. That time, the patient may have difficulty in breathing. So, that is a time, so they have to rush to the hospital, otherwise, it can be an emergency. Then heat, again, this question also I have already described. Variations in the temperature can cause urticaria. Urticaria causes swellings of the eyelids and lips in the form of angioedema. Even a vulval swelling can happen in cases of angioedema.
Okay, so urticaria cause swelling and urticaria can be affected by heat, as doctor have already told us. Doctor, we have discussed about symptoms, treatment, and I think we are more clear now about urticaria, the myths and misconception. Before we end this live, any takeaway message for all the viewers who are watching this live?
Urticaria is a treatable condition. So never self-medicate. Always consult your dermatologist because they are the better people who are going to identify what the cause of your urticaria is and treat it effectively. So never take it for granted that urticaria is a small disease or something which I can manage on my own. I need not consult someone. Urticaria patients do need consultation, do need help from dermatologist so that it can be effectively controlled.
Okay, so do not self-medicate. Do not think that urticaria can be controlled while you go and refer to a dermatologist. Thank you so much, Dr. Spandana P Hegde, for your valuable time. And it has been a very informative session for our viewers, and I am sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know that instead of self-medication, it's better to approach a nearby dermatologist. And it is really great to hear you. And we really look forward for many more such sessions in the coming time as well, Doctor.
Yeah. Thank you so much, Miss Sanya. Had a wonderful day. Thank you.
Thank you. Thank you so much, Doctor. And thank you so much to all the viewers for your excellent participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all.
Thank you.